Tips from your dentist on bruxism. The average dentist is faced with many different aspects of oral health every day. It isn't just the place to go for tooth extractions or fillings. Medical science has determined that the mouth and teeth deserve a special branch of medicine called dentistry. That is because so many problems arise from that relatively small cavity that it comprises an entire field of study. Some issues that are a part of the dental practice's realm are oral cancer of any of the tissues in the mouth, infections such as canker sores or herpes simplex, epulae, and bruxism. These are only a few of the diseases the dentist must treat. There are numerous others. Bruxism. You may not have heard this term before, but you are probably familiar with what it is. If you are not personally affected, then you probably know someone who is. Your dentist definitely knows the problem and various treatments for it very well. Bruxism is clenching and grinding of teeth. If they grind their teeth during sleep, they may not be aware of it, but their partner surely will. Grinding noises, as the upper teeth glide over the lower ones in opposite directions, can be quite astounding. People are more aware of this habit if they are day grinders. For that reason, daytime bruxism may be easier to rectify, as this can be pointed out by others when it happens. Patients clench or grind teeth on an unconscious level. Once awareness is established, correction can commence. What are causes of teeth grinding? It seems that the more type A personalities are affected and seen by the dentist than type B for bruxism at some point in their life. This probably has to do with psychological makeup of the individual and their individual skill in dealing with stress, anger, or anxiety. Some people take responsibility to such an extent that it is on their mind even in their sleep, and definitely during their waking hours. Others are blessed with a laissez-faire attitude and never lose a moment's sleep due to worries or problems. Every individual is unique and therefore reacts differently to stimuli. Stress and worries can overwhelm even the most laid-back person, however. Sometimes an emotional rise manifests itself in physical actions, such as teeth clenching and grinding. No other cause of this condition is known. Treatment. When the dentist sees a patient with teeth that are abraded or chipped and cracked, or tight jaw muscles, he may diagnose bruxism. With a diagnosis, the dentist can then establish a treatment program. The easy fix is the elimination of the stress that causes this behavior. If that is impossible, there are other measures to help a patient. Mouth guards, worn especially at night, will at least protect the teeth from being ground down. Another more permanent treatment is to introduce the patient to relaxation techniques or even biofeedback. In some cases, mild sedatives may be of benefit to stop the destruction of teeth and tissue in the patient's mouth.